Hello, my name is Pali Hungin, and I'm the Emeritus Professor of Primary Care and General Practice at the University of Newcastle upon Tyne in the United Kingdom. I'd like to say a few words about upper gastrointestinal symptoms, particularly symptoms which are thought to be related to gastro-oesophageal reflux, symptoms which have been characterized in the past as being GERD, which is gastro-oesophageal reflux disease. Upper gastrointestinal symptoms are extremely common worldwide, and the prevalence has been put at between 20 to 40%. I'd be very surprised if anyone watching this video has not experienced heartburn, indigestion, or regurgitation symptoms at some stage. The prevalence of these symptoms is rising quite quickly. We don't quite understand why. Perhaps it's because we are learning to characterize them more, but also because of changes in lifestyle, changes in diet, perhaps a more sedentary approach to life, as well as, of course, the fact that the world over there appears to be an epidemic of obesity, certainly weight gain, not only in Western countries, but elsewhere also. Over the last few years, primary care doctors as well as pharmacists have been consulted all over the world by people with upper GI symptoms and reflux-like symptoms. Reflux-like symptoms can be characterized as a feeling of regurgitation of food or stomach contents towards the esophagus, or some form of discomfort, which in many Western countries is called heartburn. Over the last few years, as a result of some influential working parties and because of wonderful advances in the management of these problems, the proton pump inhibitors have become quite important. With the proton pump inhibitors, the PPIs are the mainstay of managing these symptoms in many parts of the world. And in fact, in many parts of the world, you can buy the PPIs over the counter without having to consult a doctor. And this is where the role of the pharmacist comes in quite strongly. Having said that, and having said how important PPIs are in dealing with reflux symptoms, particularly when there is proven esophagitis, by that I mean an inflammation of the lower esophagus, normally found on gastroscopy, we know that the PPIs are excellent for dealing with established inflammation and esophagitis in people with these symptoms. The difficulty arises in people who don't necessarily respond either fully or not at all to these PPIs. Our assumption quite often is that reflux and reflux-like symptoms are due to acid problems. But of course, excessive acid is really quite an uncommon condition. There is the Zollinger-Ellison syndrome in which you get hypersecretion of acid, but that's a rare condition. And it is not acid alone that causes these symptoms. Stomach contents, including powerful enzymes such as pepsin, can reflux into the esophagus. In addition to that, there's a whole range of functional problems of the upper GI tract, including those from the esophagus, which can cause these symptoms. So that in these people, acid suppression is not necessarily going to be the answer. Trying to find out and trying to delineate between those people who need proton pump inhibitors to suppress their acid, and trying to figure out which people are not likely to respond to PPIs and might need a different approach is quite a challenging question. Of course, in the ideal world, we would not develop these symptoms. We would eat more sensibly, not gain so much weight, and obey certain rules in terms of avoiding fluids before going to bed and so on. But at the same time, we have to admit that we're all only human. People with these symptoms are going to persist for a long time. So what alternative strategies can we use? What alternative strategies can we think of? There are, of course, a number of important rules to follow. Someone with a new onset of symptoms, particularly in the older age group, needs to be investigated. In countries where there is a higher prevalence of ulcer disease, people need to be tested for Helicobacter pylori and considered for eradication. In many instances, people may need a gastroscopy. But let's assume that someone has had all these tests and then still suffering from these symptoms. That is a group of people which interests me particularly. And as a general practitioner, working with my pharmacy colleagues, I see this group of people as a massive challenge. How are we going to approach their symptoms if the PPIs are not working? In fact, data indicate that only a relatively small proportion of people with upper GI symptoms will respond to PPIs in the longer run. In spite of that, we actually have huge numbers of people taking PPIs, possibly 5 or even 10% of the population in some countries. And of course, their rather indiscriminate use has led to confusion about their effectiveness in particular settings. So what I'd like to do, if we are given the chance to work with colleagues, is to discuss alternative strategies, as well as PPIs, of course, as to how we can treat these rather difficult, awkward conditions, which present frequently both to the pharmacist and to the general practitioner. Thank you.